Hi there, I'm Dr. Ajaya Kashyap, and we'll be talking about liposuction today. Liposuction is a way of getting rid of excess fat in the areas where there is lipodystrophy or deposition of extra amounts of fat. Next generation liposuction. There are many ways of doing it. VASER is a common way of doing it, or power assisted liposuction, or tumescent liposuction, or microcannular liposuction. However, the next generation of liposuction means doing a composite liposuction, which means using whatever technique is necessary and advantageous in that situation. If you do not want the skin to get too loose, we use VASER liposuction. In the areas where you want to remove pure fat, where you don't want to damage any of the structures around, and do not want to have any of the risks with excess swelling and so on, we use a water jet liposuction. Where there are small superficial deposits, we use what is called as microcanalicular liposuction. There's a small thin cannula that is used instead of the usual cannula to just remove the superficial layer of the fat. The additions that came subsequently were called power assisted liposuction, where the manual effort becomes less for the surgeon and there is a rotating or a vibrating element to the cannula which is suctioning the fat. The third thing that came was laser liposuction, which is available as slim lipo or smart lipo. Those that were introduced as an intent to decrease the looseness of the skin once the fat was removed. Following the smart or the slim lipo, which did not become very popular, there came VASER liposuction. The name is an acronym, but it was named so that it resembled a laser liposuction. However, it is essentially an ultrasound assisted liposuction. There was another liposuction machine which was also ultrasound based, and that was called Lisonic. The latter is almost gone now, and VASER liposuction is quite popular. VASER liposuction has been there for probably about 20 years now, and it has shown very good results. However, there are some problems with VASER liposuction as well, and some of the problems with VASER liposuction can be helped by a technique called water jet liposuction. Called next generation or composite liposuction, which is VASER liposuction with some water jet liposuction, and also some microcannular liposuction to smoothen out the very superficial layers. And wherever there are small contour deformity, and sometimes even for areas where there is some deep cellulite. It does not help the superficial cellulite, however. To see who's a good candidate for composite liposuction, it is someone who has limited areas of excess fat deposits. Now, with the composite or the new generation liposuction, we can deal pretty much with any area. There are some areas where we can use VASER, where there is a lot of loose skin possibility. Some areas where you want to be very careful and remove just the fat, just pure fat. Sometimes you want to re-inject it. Those areas we use water jet liposuction. And then again, for very thin areas, where you have just superficial fat pockets which are irregular and kind of deforming, we use microcannular liposuction. So a composite liposuction would use all three. We do not use some smart or slim lipo anymore because of it offering no advantages over VASER. And the other liposuction techniques I feel have proven to be much superior. Who is a good candidate? A person who is in otherwise good health, has isolated deposits. It could be for men, very often it's the abdomen, the sides, and the lower back, the circumferential area around the waist. For the ladies, it is that area. And for the ladies, you also have excess fat deposit in the upper parts of the thigh very often called saddlebags, and love handles, which is the sides of the abdomen. So those areas can be dealt with very well. I do not advise too much liposuction in the lower part of the buttocks, but sometimes upper parts of the buttocks do need some liposuction. The safest technique for liposuction today is this composite or next generation liposuction, which has the benefits of both the VASER, the water jet liposuction, as well as the microcannula liposuction. So all three techniques are used, and the safety increases because of that. It is like if you've taken something which has both ibuprofen, brufen, with some acetaminophen or with paracetamol, the effect becomes much more, and the risks become much less because each individual medicine is less in amount, so the risk will become less, but the total amount of medicine is more, so it will be more effective. So you increase the safety as well as the efficacy of the treatment. So that's why composite liposuction is probably the best thing to do right now. And you change the technique depending on the area and where you are doing it. I mean, if there's a lot of fat, the first thing is to remove the excess fat, do some skin tightening. And then in areas where there is less fat and there are likely to be other structures around, do water jet liposuction. And where you have just little deposits, somewhere like here you have a little deposit, do a microcannula liposuction where the cut is extremely small. It's just thicker than a needle. And you can do the liposuction just with that. And it does deal better with the superficial areas. Now, as far as the recovery goes, the shortest recovery with any kind of liposuction is with water jet liposuction. Again, because it kind of divides the tissue planes and just cleanly removes the fat. So the swelling is less, the recovery is faster, but we have to sometimes do VASER liposuction as well so that the skin can contract and you don't have a problem with loose skin. There will be, of course, a little bit of looseness, but not as much as would happen if you did not do VASER. Kind of results should be expected. Now, as far as how long it takes, you will have some swelling for at least 2 weeks, and after that the weight starts going down. Initially it may go up because there'll be a lot of fluid that is pushed in where you've done the liposuction. The body fluids come in. They start going down on the second day, and by 2 weeks a lot of it is gone. You see pretty good results in 6 weeks, but the best results for liposuction are 3 months. The skin contraction, where you've removed a lot of fat, in younger people less than 40 there will be skin contraction, and the skin contraction is complete in 1 year. But you have excellent results in 3 months, especially where not too much of skin retraction or contraction has to happen. There are non-surgical ways which we use to contract the skin where required, but very often they are not required, especially in young people. Expect a lot of swelling. The little holes that we make to do the liposuction, we don't close them anymore. So there'll be a lot of seepage of fluid. So be prepared to have some soakage in your bandages. And I usually advise for the first 2 days to have some kind of a sheet above your bed sheet so that the bed sheets don't get soiled. Or you can use some chucks or some pads to prevent that happening. The feeling as far as pain is going, it's not the way we do it, it's not a painful procedure. But you do have some achiness, like you've worked out after a long time and you have this achiness in your muscles. That's what it feels like. Or when you touch and move, you have a little bit of discomfort. That happens for the first couple of days. After that, it's a very dull ache, and you feel quite good after that. You're up and about the same day, and you're able to resume most of your activities within a week to 10 days. I don't advise heavy weightlifting for 3 to 4 weeks, but some parts can be worked out. Aerobics can be done. Aerobic exercises can be done sooner. Desk work you can do in 2 days. There's no reason not to sit on a desk and work on your computer, on your phone, or have phone calls. Or if you work from home, then you can start working from home almost right away in a day or two. After your liposuction, you will be putting on a pressure garment, which is kind of a corset, or depending on which area of the body it is, it's kind of there to hold tissues together. It helps. It is not mandatory. So if you're very uncomfortable, take it off. Otherwise, keep it on for about 2 weeks, just to take it off to wash it. And after 2 weeks, you just use it as needed. I usually advise using it for about 16 hours a day. And once 6 weeks are done, you don't need to use it at all. The disadvantage of not using it basically is just excess swelling, which does go away with time. So if you are very uncomfortable, if you feel claustrophobic, you can very well dispense with it. And the answer to that is, what happens initially is that if you start having a worse lifestyle, start eating more, exercising less, then you can gain weight, but usually in the other parts of the body. So that's the process of increasing the cell size. The fat cell size increases initially, but if there's a lot of overeating, there's a lot of imbalance, then fat can come even in the places that have been liposuction. So a sensible diet and exercise program is all that you need. You don't need to, starve yourself. Just have a sensible diet and exercise program for maintenance. And if you want to get even better results, then you can do a little bit more of a diet and exercise regime, which would be helpful in reducing fat as well as toning up your body with some exercise. Once you go to the right person who is experienced and knows how to do it and has the right technique, it is a very safe procedure. The only thing, it has to be done within limits. There are some limits that are prescribed by American Society of Plastic Surgeons and from some other organizations. One should not attempt to do what is called a massive liposuction, where one is trying to lose 20 pounds all at once. If you have to lose 20 pounds just with liposuction, do it at least in 2 sessions. Don't do it all at once. The reason is there is a lot of fluid changes, and there are lots of things that happen once a lot of fluid and tissue is removed from your body, and a lot of fluid is put in as well. There are problems with the heart, there are problems with the circulation. So if you want to do it, if you want to do a weight reduction with liposuction, make sure that you do it in a couple of sessions. Don't do it in one if you want significant weight loss. Now, the limits that are defined are different for daycare surgery versus doing it as an inpatient, keeping you in the hospital for a day, or when they are done with an ICU stay, where you stay in the ICU, then you can certainly get much more removed. But there is no reason to have to spend a day in the ICU after having a liposuction. One can always make it 2 sessions, get less done with much more safety. Now, what else to expect? You can also expect a little bit of numbness, as if the sensation was just a tiny bit less in the areas of liposuction, because the little nerves, they get stretched out when you get liposuction. So do expect a little bit of numbness, which goes away over time. It is not a permanent problem. There will be some bruising, and that also usually goes away pretty quickly in a couple of weeks, sometimes even sooner. But some bruising is to be expected. Swelling, absolutely. Anytime you have liposuction or any other procedure, if it's done well, even then there will be some swelling. It is less with some techniques like the water jet liposuction, but there still will be some swelling. So you may be surprised that you had liposuction, had fat removed, and the clothes the next day don't fit well. There's more swelling than there used to be. But you'll see over the next few weeks the swelling goes down, and the liposuction, the fat that has been removed, you can see that the contouring in that area, and slowly you'll find out that you've had a much nicer contour than you expected, based on what you saw the very first or the second day. So just be patient. It comes out really well when done well. All right. If you have any questions, concerns, or just some doubts, give us a call in my office, and or you write to us. We have our email address here, and we'll guide you as to what the procedure is like and what can be expected. All right. See you then.